I'm Dr. Michael Ghassibi. I'm an orthopedic spine surgeon located at Meadville with Orthopedic Consultants of Meadville. I had my original medical school training here at LECOM Erie. I went off to Youngstown Mercy Health for my orthopedic residency and did my spine fellowship at University of Missouri.
In what year did you graduate LECOM?
So I graduated from LECOM in 2014.
What are you currently doing professionally?
So currently I'm involved in orthopedic spine. This is my specialty. This involves helping address spinal deformities and degenerative conditions to help patients be more active and live a better life.
What does a typical day-to-day look like for you?
So typically my responsibilities revolve either around the OR or the office or clinic. I typically see patients in the office and we do our best to try to triage and figure out their pathologies of the spine and further help them. This doesn't just include spine surgery, and for the most part a lot of our patients do very well with physical therapy and other conservative treatments. The patients that do need spine surgery involve my hospital part of my job. This is where we're in surgery, typically all day, involved with cases either simple or complex of the cervical, thoracic, and lumbar spine.
What were lasting impressions LECOM left on you?
So what I truly appreciated from LECOM is, again, the opportunity to be here. Everything is set in place to have a successful life. That doesn't mean being a surgeon, but just to have a very fulfilling life helping treat patients as a physician. I do think I did very well with the structuring of teaching. Myself, I was PBL, and I do think because of that I was able to excel in my studies, being able to really learn from the standard and traditional textbooks and apply that to the clinical setting. I know with LECOM we had many sites in the northeastern area, which made it a lot easier to be in places near family and to hospitals that I did eventually want to work with. The one I work with is Meadville, and obviously this school is very involved with medical education there. So I chose the EAP program just based on my background. My father, he's an ICU pulmonary doc, and he never convinced me to go into medicine. It was just being involved with his life, seeing his happiness with his life and work that really took a passion to me to consider it. Early on, I knew this was something I wanted to do, and thanks to the programs we have here, I was able to do that. I went to St. Bonaventure, where I really enjoyed a good liberal arts education. I had less stresses, I do believe, than most traditional students, as I was able to focus on learning and education versus trying to study as hard as I could to get into med school. With that, I think a very well-balanced education, knowing I'd be going to medical school in the future, allowed me to have a much more fulfilling earlier life and dive into medicine accomplished and happy to tackle on the new challenges. So I would say the problem with PBL is my favorite class was the problem-based learning. It was phenomenal, and at the time I think LECOM was one of the few doing it, but obviously nationally that caught on. But to be in a room with a clinical instructor, typically they were a physician, either practicing or retired, and to apply all the knowledge we learned from these textbooks to interesting cases really helped all the knowledge really stick and really helped prepare me for my clinical rotations much better than I thought I would. So what I did appreciate with LECOM is they're very straightforward. As long as you're doing the work and you're learning as best you can, the rewards reward themselves. With the problem-based learning, I do think this really helped excel me into the clinical side of things. Instead of many lectures being fed to me, I had to analyze and synthesize the material myself. And this truly carried on as you get into the normal stages as a physician. Really, a lot of times no one is hand-holding you, no one is lecturing you. You're just picking up a book, trying to synthesize material and apply. And I do think the PBL program definitely helped prepare me for that. Well, thankfully, with my diligent work, I was able to be rewarded for my successes in academics. The medical school was kind enough to give me several scholarships, I think including the Merit Scholarship and the Herzl Award. These things really help to show that the school really supports its students and wants to recognize especially the successes we can have in medical school. I'm super thankful again for the opportunity to have attended my medical school here at LECOM. Life is variable, but thanks to it, I'm in a very happy place with a great family. I couldn't have done it with the instruction I had here and the valuable skills and learning that I could apply in my clinical setting. In the end, my biggest accomplishments is having a great mom and dad that has helped support me through this, so I truly thank you both. So in addition to graduating from here, I'm back here teaching courses that do involve the spinal cord and the pediatric spine. I do think in reference to the big theme of education here, it's always important to give back. I do really appreciate everyone that's taught me, so if I can do just a little bit of it, it's always very fulfilling to help teach the future generation.